I think the issue of ageism is just huge in our healthcare system. And it is so ingrained that I think people don't even realize. And I think, and now I'm speaking about, culture as well, because in the US, I know that ageist stereotypes are ingrained in us as children, beginning very, very early on. And I think the way it impacts our healthcare system, there's so many examples I can give you, but um, to try to give you a few that are very relevant and that we saw so blatantly, devastatingly occurring during the pandemic was that older adults often present with atypical presentations of disease. Okay, so, and that is common. In fact, they present atypically more often than they present typically. So for instance, if someone comes in with a heart attack, right, we're taught in our training to look for, crushing chest pain, the pain radiating down the arm, shortness of breath, right? Those are the classic things we're taught to look at. But if you look at huge studies of older adults, the number that present with those classic symptoms, it's way under half. They're much more likely to present with either vague complaints like, oh, I'm having a little indigestion. Oh, I felt a little short of breath. Or the family bringing their loved one in and saying, they're just not right. They're not eating. They're not doing any of their usual activities. They're just sitting in the chair. Something's really wrong. You have to be very attentive to those things in an older adult. The problem is that when physicians and nurses don't recognize those atypical presentations, life-threatening diseases can be missed, right? And so we saw that happening during COVID. Older adults don't always present, or in less than half the cases, with classic fever, sore throat, cough, the classic symptoms. Even pneumonia symptoms were often lacking. They much more often presented with delirium or with falls or with failure to thrive. They're just not eating, they're just not themselves. And so the consequence of that was that COVID was missed, right? And patients were sent out of emergency rooms without being tested. They were sent back to their living situations or to their nursing homes, and the epidemics took hold. And it really was because of ageism, because of a lack of awareness, first of all, a lack of education, right, of our healthcare professionals about that this is the common thing you need to be aware of. And second of all, not making the testing widely available to older adults. And third of all, the pandemic also showed that in areas where older adults lived, there wasn't a priority to getting protective equipment and testing and all the things that were needed into those communities really rapidly, and contrast that with what happened in colleges, right? And how quickly all of that stuff was made available in colleges, in workplaces, but not in nursing homes and assisted livings, which were having the highest mortality rates. And so again, it just comes back to prioritization and ageism. And I firmly believe that a healthcare system is only as good as how it takes care of its most vulnerable. And that includes our older population, our disabled population, and our cognitively impaired population. And it's emblematic of a healthcare system. How well they do with those populations is how quality of care should be judged. And so I hope we can, and I have confidence that we can do a better job. And I think that the pandemic has raised awareness. And I just hope we can turn that now into action and making a difference and really addressing ageism, which I think is it remains a socially acceptable ism, but it is just so detrimental to all of us, right? To our current and our future selves, because it's been shown time and again that a healthcare system that takes good care of older adults, it takes good care of everyone. So we need to keep that in mind, because if we're lucky, we will all be older adults.